Welcome and thank you for coming to the webinar series from the Eye and Ear Foundation called Sight and Soundbites. This is a bi-weekly webinar series that highlights research at the University of Pittsburgh School of Medicine. My name is Craig Smith. I'm a development officer with the Eye and Ear Foundation. The Eye and Ear Foundation supports research to advance care for vision, hearing, balance, voice, and cancers of the head and neck at the two world-renowned departments of ophthalmology and otolaryngology at the University of Pittsburgh. The funds we provide from the Eye and Ear Foundation to support research are only made possible because of philanthropic support. So we'd like to thank everybody who has supported the foundation in the past. A few housekeeping rules I want to go over before we get started today. You'll notice that the chat is disabled, so you will not be able to chat during today's program. However, we encourage you to ask questions with our doctor. You can see the Q&A function at the bottom of your screen. Please feel free to submit questions throughout the entire program. And at the end, Dr. Smith will answer some of those questions. We do ask that you refrain from asking any very personal health-related questions that might not be relevant to the larger group. However, if you'd like to ask questions about your specific case, you can please feel free to email me, and I'd be happy to share those questions with Dr. Smith offline. My email address is craig@eyeandear.org. Also, you will be added to our email list today so that you'll get emails for future webinar invitations following this presentation. And we'll also be sending out a recording of this presentation in case you'd like to rewatch it or share it with any friends or family. Today's topic is protecting and preserving your voice. And we're joined by Dr. Libby Smith, director of our Voice Center here at UPMC. Dr. Smith is a board-certified otolaryngologist who specializes in the care of professional voice and the treatment of voice disorders. She's a member of the Pennsylvania Academy of Otolaryngology-Head and Neck Surgery's Voice, Speech, and Swallowing Committee and is on the Triological Society's Eastern Section Nominating Committee. Dr. Smith's primary area of research is the treatment of vocal fold paralysis, utilizing laryngeal EMG to guide customized patient treatment, as well as vocal cord augmentation. Her passion has been surgical ergonomics, optimizing surgeon positioning to reduce musculoskeletal injury. So I will turn it over now to Dr. Smith.
Thank you very much, Craig. And thank you to the foundation for inviting me to talk today. So we're going to talk about protecting and preserving your voice. All right, so I do have a disclosure. I am on the advisory board of Inovio Pharmaceuticals, but it is not relevant for today's discussion. All right, so let's start with why is voice important? We're going to get into that and then followed up by basically how is voice produced so that we understand what's going on, and then what can we do to preserve and protect it. So if you look up voice in Merriam-Webster dictionary, it says that voice is the musical sound produced by the vocal folds and resonated by the cavities of the head and throat. It also mentions that voice is not just sound that we make, but it's also wish, choice, or opinion openly or freely or formally expressed. And then my added thing is that's either your personal voice and maybe your community voice. So voice has multiple definitions, all of which are important. So we want you out there being able to have your voice, So if we think about it, if you're a violinist, you store your violin in your violin case and keeps it all nice and protected. Unfortunately, our larynx, our voice box, is not like that. Rather, it is in us. And so we're going to talk a lot at the end about, wherever our voice goes or wherever our body goes, so does our voice. So our environment, its shell, the body, and your outside environment will definitely affect voice. So let's talk about voice production, a little bit of like 101 on voice. So obviously we have to think of the thought of saying something or making a sound, but our first step after that is how do we make it happen? We have to power that voice with the air coming from our lungs, followed by the air shooting through the vocal folds, which we're going to talk a lot about, as an oscillating source. And then that sound that's created from those vocal folds vibrating together and the air going through them, it's modified by our resonating cavity. And that's what really makes everyone sound different. So most females have fairly similar vocal folds as long as they're of a similar age, and we'll talk a little bit about that. Men likewise, but what makes me sound different than Christine or Angie or whoever is basically little idiosyncrasies of the vocal folds themselves, but mostly the resonating cavity above. So your voice box is housed in your neck. So this is where I'm envisioning everyone putting your hand on your neck and feeling. If you're male, you're going to feel your Adam's apple. You're going to go south of that just a little bit. And in women, we feel our cricoid, which is the most prominent part, which is in green on this slide. And you go north a little bit. So kind of right in between those two, that's where the vocal folds are. So this is what they look like when they're not moving. And so the white structures are the vocal folds themselves, and everything that's kind of pinkish, they all have names, but those are other normal parts of the voice box. Those knobby things up at the top, those are the joints that move the vocal folds. So we're going to see them in a moment, but you'll see that the vocal folds will open and close. All right. And the dark air down in the middle, that goes down your windpipe, your trachea. And further south of that are your lungs. So that air is generated from your lungs, shoots up through the windpipe or trachea through closed vocal folds, and that's what makes sound. So it turns out these vocal folds are absolutely amazing, which is probably why I'm a laryngologist, because I think they're just so cool. So the edges of the vocal folds will vibrate together, creating the sounds. And this requires really fine muscle control. So that is allowed by the specialized covering of the vocal folds. And this is called the lamina propria. So on this depiction, the yellowy, jello-y stuff, that's the superficial lamina propria. And it is absolutely the key to phonation. Without it, you sound horrible. And you may not be able to make much sound, frankly. And so this is really important because this is where most non-cancer or benign lesions occur. But it's also what's needed for vibration. So there's a high sensitivity to injury, which is unfortunate, and extra unfortunate, it's very difficult to repair. So a lot of what we're going to talk about later on is how do we prevent injury from occurring in the first place, because it is so difficult to repair. So this is a depiction of one cycle of vocal fold vibration where the vocal folds come together, the air coming up from the windpipe exceeds the closure pressure of the vocal folds and makes them open. And then they snap back together, and that's one cycle of a mucosal wave. Now, what's super amazing is that in men, this happens in normal talking speech. It happens about 100 times a second. And in women, it's about 200 times a second. And for our singers out there, especially our sopranos who can hit a high C, that's 1,024 times a second. I'll just let that sink in. That's insane, right? So you've got this really delicate layer that's banging against the other side hundreds of times a second. It's pretty remarkable, actually. So this is actually a video of high-speed photography of vocals of this mucosal wave. So this isn't what we use in the office, but it's kind of shows that depiction of that wave running through the vocal fold. So this requires coordination of all the fine musculature of the larynx to create that, the lung support for it. Also shows the delicate nature of the edges of the vocal folds, which are key to phonation. And then we saw like that rate at which it was vibrating, and that's what correlates with pitch. So lower pitch, lower frequency, higher pitch, higher frequency. So if you can imagine that, see that V of white, those are the vocal folds, okay? That kind of tongue-looking thing you see at the bottom of the screen is not actually your tongue. And then the top part of the screen, that's actually the front of your spine. So you can kind of see where we are wedged in space. So imagine when we make sound that V, we're getting the air through, you then close the vocal fold, so it becomes an I, and then you shoot the air through, and then that's what makes sound, okay? So oftentimes when people have hoarseness, eventually they'll get to an ear, nose, and throat doctor. And I'm one of those with the specialized training in voice care. So I want to go through next a couple entities that are really common in what we see and hopefully will resonate with several of you. So the population overall is aging, and it's reported that by 2050, over 20% of the population will be baby boomers. And so with that comes changes. We know that the body changes in general, but our voice changes too, and that's normal. So I call it the normal process with years of wisdom. All right. And so what we find is something called presbyphonia. And presby is basically age related and phonia is sound. And so this is hoarseness due to age related laryngeal changes, but also the pulmonary changes. Remember, we talked about how the lungs have to power the voice. So the most common complaint is that it's super gradual. No one wakes up with it overnight, but over time, people notice, oh, 3 years ago, my voice maybe started getting worse. And it's raspy, inconsistent, not quite sure what's going to come out, fatigues fast, oftentimes have decreased projection, not being able to heard across a room. Sometimes you'll feel strain because you're having to work a little bit higher, a reduced range. What's interesting also is that male voices will become higher in pitch and female voices will become lower. And so for singers out there, they'll notice this in their range where they're like, oh, I used to be a soprano, but now I'm an alto. Well, it makes sense because that's what happens. And men are no longer a bass, maybe now they're a baritone. All right. So the normal process of aging in the vocal folds leads to basically decreased soft tissue bulk. And this is not just in the muscle, but also in that squishy, gooey yellow layer there, the superficial lamina propria. You also lose tone, and this one's really tough. So instead of having normal, bulky, taut vocal folds, you now get skinny, floppy vocal folds. So I equate it to, I use the analogy of imagine you've got a guitar string and it's just too loose. Okay. You can still pluck it and it can make sound, but it's not going to be the robust sound that you're looking for. Unfortunately, we have no way to tighten up the string. All right. So we're going to talk about what we do for treatment for that. We also mentioned a little bit about the respiratory system because that's what drives the power of the voice. So as we age, there's rib stiffening. So it takes a greater force to get that air going. There's also decreased elastic recoil of the system. And so that requires more force. And in the end, you just have overall decreased muscle strength, both for the inspiratory and expiratory muscles. So oftentimes when folks come in, their main thing is they want to just make sure they don't have cancer. And that's about 40% of patients. And oftentimes, most often, we're able to give them that assurance because we can look at the vocal folds. About 60% of patients actually they want more from their voice. So they're happy they don't have cancer, but they want more. And so the treatment oftentimes is voice therapy. And we're going to talk a little bit about that. Only a very small group of patients is surgery actually indicated or even needed. And even then, the results for surgery are not always a grand slam. Sometimes there's modest improvement, sometimes there's no improvement, sometimes it's amazing. So we don't know yet who those people are. So further research needs to be done for that. I alluded to voice therapy being really a key. This is really the cornerstone of really laryngology in a large part. So this is done by our speech language pathologist colleagues, and they will work with each individual patient working on the coordination of airflow, vibration, and resonance. And a good amount of our upcoming research will be based upon this. So it's a matter of coordinating that because person A and person B, although they may still have atrophy-related hoarseness, they may need different techniques, different strategies to get more consistent voice. Specifically in the arena of atrophy, can we do anything with the lungs, right? That's the first step. That's the power source. So it's actually known that the more you use your voice and hopefully use it well, the better it is. You don't want to have disuse atrophy. You also need to think about how you're going to drive that system. So singing requires more oomph, right? And so a lot of folks are in choirs, which is amazing because it's going to keep your phonatory system in tip-top shape. There are also devices that can be prescribed by your physician for strengthening those muscles that we talked about in your rib cage, okay, to basically get the lungs to expand and then to close so that you get that air force. And so this is an example of one of them. And it's been actually shown to improve glottic pressure and airflow, which in the case of voice is a big part of the pulmonary drive component. So being active is always a positive. So imagine the voice coming from the gentleman in the wheelchair. It's probably not going to be as robust, frankly, as his caregiver. And maybe then very much less than the two people trouncing up the hill with their puppy dog. But showing that being active physically is really important. Okay. We talked at the beginning about the voice is housed within you. So wherever your energy level is, your voice can only match it. It cannot exceed it. So if you're not a very low energy level, your voice can only do so much because you've only got so much to give. So the more energetic you are, the more voice you can have. All right. So here's a little shout out to Pittsburgh. So we have very enthusiastic fans in Pittsburgh, and these are a couple examples I found online. Unfortunately, when the moment of whatever activity you're in overtakes us, this oftentimes leads to vocal misuse and potentially overuse. So this is the result of like yelling or the quality of your voice, as well as the quantity, just talking too much, right? And so I always joke, I don't take care of too many computer programmers because they're not talking to a lot of people. Oftentimes it is sort of a stereotype, but it sort of fits. So a lot of our patients are teachers and pastors and physicians and people in vocally demanding jobs, right? So what we know is that yelling creates more of a direct trauma to the vocal folds. Now, remember that they're contacting each other 100 plus times a second, right? And you're just doing that with even more force, okay? So that's not so great. And you can see where in that delicate structure of the vocal fold that you're going to have injury. You also need to give yourself a break sometimes, right? And so people don't think of voicing as an activity. It's just something we do, right? But it does expend energy. So imagine you were asked to go walk for 10 hours straight and don't stop, right? You're probably going to be pretty tired, right? So you have to think about it. Just as you would give yourself a break while walking, you also need to give yourself vocal breaks. And that's really important. So we think about also where we're voicing. So there are vocal danger zones, okay? And these are basically just loud environments, whether you're rocking out at a party or really restaurants are super, super loud, or you're at a concert, let's say, right? So what can we do to mitigate voicing in these vocal danger zones? What happens is that you end up yelling automatically. You don't even know you're doing it over the baseline noise. It's called the Lombard effect. And so you're yelling and not even realizing. So what we can do is you can use earplugs, even just one of them. So I'll tell like my servers at, whatever restaurant chain to put one earplug in. And you'll actually be able to hear yourself better and therefore not feel compelled to yell. So this also helps your hearing, right? Which our otology colleagues are very, very happy about. But it will also protect your voice. So one of the more common things we also see is something called muscle tension dysphonia. And this picture may not look like any of the ones you've ever seen, and that's the whole point, right? So we can't even see the vocal folds on this picture, right? And that's because all the tissue above is super scrunched over it, okay? And so this is called muscle tension dysphonia. It's basically an inappropriate use of the muscles when making sound. So it would be understandable. These folks are going to come in and they're going to complain that their voice is raspy. They get super tired while talking. It's really effortful to talk because they're talking like this because they've got so much tension in the system. It can even be painful and their voice will be inconsistent. Sometimes their voice will come out totally normal and the next second it's horrible again. So what this relates to is the orchestra of events of muscle contraction in order to create voice is not efficient and not effective. Okay. These patients are working really, really hard to make sound and eventually the voice just cuts out. Another thing that can happen from this overuse and misuse is you can get benign bumps, not cancer bumps of the vocal folds. Well, while these are not cancerous, they greatly impact the patient's ability or the person's ability to create good voice. So, they may start avoiding social situations, stop singing in the church choir, all those activities that bring them joy, right? So we can imagine that these bumps on the vocal folds are going to impair that wave, that mucosal wave that occurs through the vocal fold, as well as the glottic closure, which is also needed. If you have air scooching through, it's not going to be as effective and you'll hear a raspy, breathy quality to your voice, okay? And so you can have these bumps for that. So oftentimes, you saw this slide before, the treatment is oftentimes voice therapy. This is really the cornerstone for these patients, both the muscle tension dysphonia folks and most of the benign lesion folks. So the speech language pathologist is again focusing on the coordination of airflow, vocal fold vibration, and resonance. And so it's very individualized approach with lots of different skills and strategies to recalibrate how the voice works. So every once in a blue moon, I get to step in and I'm the surgeon. So this is a short depiction of what the surgery kind of entails. It's a very small percentage because our speech language pathology colleagues, because they're specialty trained in voice, which is not the norm in the community, but for us it is because of what we do, that the majority of people actually do well without needing surgery. And so for those folks that get there, you have to recall that the superficial lamina propria, that yellow jello-y layer that allows for mucosal wave where most bumps live, is only 1.5 millimeters thick. Okay, again, 1.5 millimeters thick. So it's super small. Remember, it's delicate. It's a really intricate space, so everything's done underneath a microscope and very small instruments to remove these lesions. So this is basically like a pre-post of what it looks like before and after taking off the lesions. It's just different camera angles, so you can kind of see how removing them now restores the natural contour of the vocal fold. So let's switch gears a little bit on, okay, how do we make all that never have to happen, right? So preserving and protecting your voice. Well, one of the first things we can do is focus on vocal wellness. So this is our most popular handout that we give folks, and we're going to kind of hit each of these. So, but I also just want to show a nice, pretty morning in Ka'anapali, Maui, with the rainbow. So everyone, hopefully it gives everyone a smile. Okay, so aerobic activity is really important. Where we talked earlier about being the opposite of frail, but rather being active. So aerobic activity helps strengthen pulmonary drive, and I call it oomph because everyone kind of seems to understand what oomph is, right? It's critical for driving the voice. So with oomph, you'll have more pulmonary engagement and thus more power in your voice. We know that physical conditioning and exercise are a key part of this. So not only will you feel better overall, I'll give a little shout out to later on, we're going to mention sleep. It also is going to help you sleep better, but your voice will also perform better. So for folks with lung disease or who smoke, these are obviously counterproductive to that goal. And thus, sometimes you'll have more innate oomph, and therefore your voice will be more challenged just solely because of that. All right, so what happens when we smoke? So obviously we all know that smoking, no matter what you're smoking, is bad, right? And we all fear cancer, which can happen, which is the bottom picture. But there are non-cancer changes to your vocal folds that also occur, and that's the top picture. So that top picture is something called Ranke's edema, and it's where that yellow superficial lamina propria layer becomes abundantly huge, right? And what's going to happen is that's going to change the way the vocal folds vibrate. It's actually going to drop your pitch tremendously. And usually it's the women that come in complaining of this because they're being mistaken for men on the phone. Men don't seem to mind as much because, I don't know, sounding like Barry White may be actually a positive, but for women it's not. And so oftentimes they do need surgical intervention to help with that. So obviously neither of these sets of vocal folds are going to sound good, right? And again, the bottom picture with the cancer, I mean, it doesn't hurt, but that's going to not sound good, okay? So it brings me to one of my big points of, if you're over the age of 40 and you've been hoarse for really 2 to 4 weeks, more than 4 weeks, you need to have your voice box listened to, because we need to rule out that something bad is going on, okay? And so that's where you come and you see an otolaryngologist, an ear, nose, and throat doctor, and they pass a scope in your nose and they take a look at your vocal folds right there. And oftentimes, at least for us, we can show them to you. And sometimes you can, and sometimes you can't, depending on the physician you're seeing. But we can make sure that there's no cancer going on. All right. So the other really big thing that I find probably most common than anything is dehydration. Hydration is super easy, but I got to tell you, probably the majority of patients I see are significantly dehydrated. So water is required for adequate mucosal lubrication, which protects the vocal folds during vibration. So imagine you're dehydrated, they're still vibrating at 100 plus times a second. You're going to have more trauma, right? It's also not going to sound good because everything's really dry and desiccated. So there's many ways in which dehydration can happen. And probably the most common one is, frankly, just not drinking enough water and drinking way too much caffeine. And so, I'll have folks come in and be like, but doc, I'm drinking a gallon of iced tea a day. I'm like, well, all that iced tea has caffeine in it. So there is water, but you've also got a good amount of caffeine, which we know is a dehydrating source. So education is oftentimes all that's needed for this. We also find that nowadays it seems that polypharmacy, everyone is on a lot of medications. And unfortunately, a lot of those medications have normal drying side effects. And kind of the big culprits are the antihistamines and the antidepressants. So I'm never going to tell someone not to take their antidepressant. But it is an opportunity for discussion on, okay, you're going to be drier than everybody else because of this, which is fine. So let's work on how we maintain your hydration. You got to drink more water. You got to steam. Personal steamers are great. You can even use nebulized saline if they have a nebulizer at home, stuff like that. Also, with our obesity epidemic, more and more folks require positive pressure ventilation at night, and so in the form of CPAP. So while the CPAP is humidified air, it's still air blowing past the vocal folds in a pulsed fashion throughout the night, and they're going to dry out. They won't be as dry because it's humidified air, but it's still going to dry you out. And so everyone wakes up dry. And so again, another point for education is this is totally normal. And so you just need to think about, okay, I need to drink some water when I wake up. I need to take maybe a longer shower than usual, whatever it may need to rehydrate the vocal folds after a night of CPAP. So hydration, I'm going to show you an example of what just hydration alone can do. So this is a patient who was seen for hoarseness, and out of all the voice boxes you've seen, this one doesn't look the same, right? So you can see the staining from the tobacco, but also everything just looks like you just want to have a sip of water when you see this picture, right? So after probably about 2 months, they quit smoking and they used a steamer, okay, and drank more water. It's just that was it. There was no medicines or anything, and there they are, right? So it's not a normal voice box, but boy, is it way better, right? And their hoarseness was significantly improved, okay? And that's just with drinking water and stopping smoking, all right? So another thing we can do, our parents always tell us that you are what you eat, and that is super true. So if you eat foods that provide you good energy, then you yourself will feel better. Okay. There are also a lot of natural foods are hydrating, so it'll help you with that hydration component. But we also have to think about the foods that can cause reflux, right? So reflux has been for the last 10 years really the culprit of everything bad in medicine, it seems. And so it's probably an over diagnosis of it, but it is a real entity. And a lot of times, if people actually have reflux, you'll have the heartburn and the indigestion, but you can also have hoarseness. You can feel like there's something stuck in your throat. We call that globus, frequent throat clearing, and excessive phlegm production. So we know that reflux is worsened by everything that tastes good in life. So caffeine, alcohol, chocolate, mints, spicy foods, fatty foods, tomato-based foods. And then in our lifestyle, if we eat and then lay right down, it hasn't even like gotten through our stomach yet. And so the chances of regurgitating it back up are higher. We also know that there's more reflux with CPAP and also obesity. So what can we do, right? We should eat healthy, balanced meals, right? Everyone has their own version of that. And so whatever works best for you, avoiding the things that we know cause reflux in everyone, and maybe you have certain things that you're really sensitive to. Avoiding large meals before bedtime, and you should probably wait several hours before lying down. If you know that you're going to go, I don't know, go have Italian food, which is amazingly awesome, you may need to just take a couple antacids before, right? And that's okay. That's what they're there for those moments. So, but think about how you can change your behavior, what you eat and when you eat, how much you eat, all of that to mitigate the effects of reflux. All right, so back to wellness a little bit. So I did kind of preface that sleep is important. Remember, your larynx travels with you. If you're tired, your voice will be tired. If you're stressed, your voice will be stressed, right? And so, making sure you get a good night of restorative sleep is really important. You'll, one, just feel better. And two, your voice may actually do better also because you're going to be more energized the next day. Likewise, everyone has stress in their lives. Having some mode for relaxation and, maybe even meditation or whatever it is that works best for you. It's a very individual choice. Find what that is so that when you're more relaxed, your voice again will perform better. Okay. Especially some people, it seems that their voice box and their like mental health status. So if they're super anxious, they hear it in their voice. If they're depressed, they hear it in their voice. There's like a direct link. And some people are more hardwired that way than others. All right. So we know from lots of literature that your voice quality will track with your mental health state. Like I said, depression, anxiety can manifest in voice. So we really look to, hopefully you've noticed, we take a very holistic approach to the whole person and understanding what's driving their voice issue. And so we can focus on where can we help out. And we acknowledge we are not mental health providers, but sometimes just having that open dialogue with someone really helps them realize what may be the source of their problem or their issues with their voice. It may not actually be their voice box. It's something else going on in their life. All right. And so we'll kind of help guide them through that. So in summary, I hope in the past, about 30 minutes-ish, I've given you some ideas of how to make better and smarter vocal choices. So remember that hoarseness is never normal, especially if there are repeated episodes. You need to have someone take a peek, but also pass info on, be advocates, use your voice, not only for yourself, but for others. Provide them the info that you now have, because everyone in our community needs a voice. So I'm going to give a quick shout out to World Voice Day. I just want everyone to know this is coming up in about 2 months. So World Voice Day is a worldwide day in recognition of voice and vocal wellness. It's always on April 16th, day after tax day. So I challenge everyone, not just today, but maybe even especially on April 16th, to think about how you will use your voice. What's important to you about it? What can be better? How do you want to be heard? Okay. And realize that everyone has a voice and we're always here to help. That is it. Thank you very much for your attention. Are there any questions?
Yeah, thank you. Thank you, Dr. Smith, for a great presentation, a broad overview. We do have some questions already, and I'll say again, if anybody in the audience has any questions, please feel free to submit them through the Q&A function, and we'll kind of dive right into those right now. So first question we have is, how long does it typically take for a person to develop a voice issue? Can it take years, days, or is it really a matter of who it is?
Yeah, it's a great question. So unfortunately, the answer is probably not very helpful. It's super random. So it really depends upon what's driving the voice issue. Out of the things we talked about today with misuse and overuse, which is really common, it usually takes periods of time. So that can be on the order of weeks, months, years, right? And oftentimes we find that it tracks a little bit, and I alluded to it, with someone's personality. If you're a very outgoing, gregarious, vocal person, probably at higher risk of having voice misuse, overuse, because that's just who you are, right? Versus someone who's more detracted and quiet. So sometimes it's accumulation over time. That's probably the most frequent. But every so often, frankly, I don't know if you remember, there's the picture of the benign vocal fold lesions, and there's a big red circle in one of them. Yeah, that was probably from someone sneezed or coughed. And that happens. And that's just, frankly, kind of bad luck. But that doesn't happen often. It's most often accumulated trauma over time.
This next question, it was sent in pretty early. I know you covered some of these things, but maybe just to kind of rehash, you could give like a top 3. But this person asked, what positive things can one do to maintain voice health?
Yeah, I think the big ones are going to be hydration, don't smoke, and be active. And then have a good sense of mental health. So have that relaxation sensed in your life. If you do those 4 things, you're probably going to fare pretty well. And that's a big part of what we cover in voice therapy, as well as the strategies of how to physically use your voice better.
How does Parkinson's disease affect the voice?
Oh, wow. That's a great question. That's probably a topic for another day, but in a nutshell, what happens in Parkinson's is kind of a nasty trick. What happens is to the outside listener, the voice becomes monotone, quiet, lacks prosody, meaning there's no inflection, no music, no melody to the voice. And it kind of sounds mumbly. Unfortunately, for the person with Parkinson's, in their head, it sounds totally normal. And so there's a disconnect between how they think it's being produced and what it sounds like to what's actually coming out, which is fascinating. And no one really understands why. So what we know is that unfortunately the medications don't usually help a whole lot with the sound of the voice. But fortunately, there are specialized voice therapy programs, techniques to improve not just the pulmonary drive, because that's part of it, but also work on the almost over articulation over intentionality of the voice to mitigate the effects of that monotone, quiet voice.
Are there any exercises, either facial or swallowing, that one can do to keep the vocal cords strong?
Not exactly, probably just use, but think about when we work with folks, and I'm not a speech language pathologist, right? So I'm the physician and surgeon. But what we know is that you want your voice to flow easily. You don't want to feel it in your neck, but rather feel it more like in the front of your mouth. So what we'll do with folks is go like you're blowing out a candle and saying who at the same time. And if you do that, and everyone can do it because no one can hear you, it's really relaxing. It's like giving a little massage to your neck without even touching it. It's great. So that's one thing you can do. There's also lip trills. I'm a little dry right now. I apologize. Again, takes a lot of airflow, but you have to be relaxed in order to do it. So those are things that I know that I do nonstop throughout the day because my job requires that I talk from 8 a.m. until 5 p.m. pretty much nonstop. So in between rooms, okay, those are things just to kind of reset.
I heard in the introduction that you specialize in treating vocal fold paralysis. What kind of treatment is there for that?
So there are many treatments. Probably the mainstay of treatment is actually not voice therapy. It's one of the few things that voice therapy is usually not indicated for, but rather augmentation of the vocal fold. So moving its midline, its position to a more midline so that the good moving vocal fold can touch it. And we do that in a variety of different surgical ways. There's also really exciting stuff going on with reinnervation. And that's where I'm using our laryngeal EMG work to study that more. But using reinnervation, so if we know that that nerve that moves that vocal fold isn't ever going to work again, which we know from EMG, that we can hook it up with a different nerve. It still won't work, but it's going to provide an electrical signal, which tends to medialize that immobile vocal fold, which is pretty cool because now you've done that and you don't have an implant in there because there are inherent issues sometimes with implants. So it's actually a really exciting, really frontier in vocal fold paralysis. We're right on the cutting edge of it right now, which is super exciting. And probably in the next 5 years, we'll have something even cooler. So, but that's the new thing right now.
Should adults of a certain age have precautionary checkups with a voice doc like they do with hearing and vision, or only if something's wrong?
That's a really great question. So I would actually say probably the latter. If your voice is overall normal to you and normal to those around you, the risk of there being cancer is low, right? Unless you're a smoker and you're concerned about that, then absolutely get it checked out. And I always say, if you're concerned about something, definitely have someone take a peek. It's not hard to do. But if you otherwise, it doesn't mean like you have to come in every year, right? So for those folks that come in and they're like, yeah, my voice is just a little bit different. I want to get it checked out. I want to make sure I don't have anything bad going on, no cancer. I don't typically see them back unless something new arises or, because the voice is going to continue to change throughout life, right? So your voice as a 20-year-old is different than a 40, which is different than a 60, which is different than an 80, right? And so some people are okay with those changes and some people it concerns them, which is super reasonable. So it's always reasonable to go see someone, but it doesn't have to be a set, like, yes, it's not like your diabetes check where you have to go in every 3 months or whatever. It's really driven by the patient and their concerns.
Do you work with a lot of singers in your practice?
Yes, absolutely. They're a great, everyone's great to work with. They pose different challenges because we have to work around, performance schedules and, You know, they're asking a lot from their voice, more than just the casual speaker. And they're looking for a quality that has to be so precise. And so oftentimes, like, people have like little irregularities to their vocal fold, not cancer, just little lumps and bumps, totally fine, right? But if you're like a high class opera singer, especially female opera singers, your vocals got to be pristine and you got to use them just right. And then you have to realize that all of the pre and post show speaking that you're doing is still using the same instrument that you're going to perform with, right? So unlike that violin where you can just take it out, play, and put it back, you're still having to use your voice all day long, right? And so it's really kind of fun because you have to think about so many other things in their life and really get to know the person, not only what type of music that they're doing, but also what are their venues and how often and how challenging, and is it a new role? Is it, you know, the role that they're hoping is going to break them out to Broadway? Like, whatever it may be, it adds those added kind of moments for them it's fun to navigate that with them, because it's really truly a journey with whoever the provider is, as well as whether it's a performer or just anyone with a voice, right? We take the journey together, and it's fun to figure out what each person needs because it's always something different.
Would dementia have the same or similar consequences on the voice as Parkinson's?
So it kind of does. It's a little bit different, but it's a really good question. So oftentimes with mild dementia, there's usually not much change in voice, other than the fact that as people age, dementia potentially becomes more of an issue. So you'll have those normal age-related changes to voice. When dementia is really severe, yeah, I mean, it will get to the point where there is a more mumbling and monotone and quiet. But what we find is, unlike Parkinson's, the voice therapy isn't effective because the patient is unable to participate in the same way because the dementia is such a barrier. So that's always a challenge. There's often, you know, we can help somewhat, but not like we can for Parkinson's, unfortunately.
Is coughing or clearing your throat problematic for vocal fold?
So yeah, I purposely didn't have a slide on that, just because it opens up such a can of worms, but I'm glad you asked the question. So it can, I mean, yeah, I guess if you're coughing a ton, yes, you can have trauma to the vocal folds. The challenge is to figuring out why people are throat clearing and coughing. And one, there's a distinction between those two. And each of them have a differential diagnosis list of like 50 things. And so it's oftentimes tricky to get to the root of it. But probably the big offenders are, because you want to figure out why you're doing it so you can stop, right? So hydration is a big one. Smoking. And even once you just stop, your cough reflexes are even higher. So sometimes people will say that, oh, I quit smoking. Why am I coughing more? That's actually normal. It'll eventually subside, but it can take 6-12 months. Reflux can lead to throat clearing. Allergies, lots of postnasal drip. So we'll go through kind of those main 4 things and see, okay, what's driving your issues, right? But it's most likely not emanating or originating from the vocal folds themselves. They're really innocent bystanders oftentimes in that equation.
As people age, is it normal for the voice to change, or is it possible to maintain the voice tone and quality over time, especially as it relates to singers?
That's a great question. So unfortunately, the voice will change, but most often people still sound like themselves, just a little different, right? Because we know, and for everyone, it's a different time in their life. But as normal aging occurs, there are changes not only to the muscle bulk, which is going to change your closure patterns, but also to that superficial lamina propria layer that leads to vibration. It actually becomes too robust. So they have an increased mucosal wave. And that extra floppiness, as well as the extra tone to the vocal folds, leads to sometimes this haphazard, chaotic mucosal wave, which can lead to more hoarseness. Really, there's no way to prevent aging from happening. But maybe think of it as, okay, if I'm using my voice and I'm using it well, great. And if I get to a point where my voice is not performing the way I want it to, whether it be in singing for the choir or singing to the grandkids or singing for yourself in the shower, whatever it may be, they're all important. Then, seek out care, because maybe voice therapy, which for the majority of people is what they need. They just need to learn how to use I kind of jokingly say, your skinny, floppy vocal folds better, right? I'm not going to change what they look like. I can with surgery, but that's not always the answer. So with voice therapy, we teach you how to use what you have better. And oftentimes that improves the voice significantly and hopefully enough that they don't need surgery, right? And if they do, that's what I'm there for.
What are some common signs that you might have throat cancer?
Well, I mean, the big one is hoarseness, right? So if you hear a change in your voice and it's for longer than 2 to 4 weeks and you're over the age of 40, that's kind of cancer until proven otherwise. You really need to prove the negative. If you think about it, if you get a cold, right, you start getting your voice back usually within a week, right? So we're outside of that normal frame of hoarseness. If you're a smoker, you have to kind of be a little bit more worried, right? Because that is a risk factor. So is drinking alcohol, especially those two together, higher risk factor for head and neck cancer. That's probably the big one. Other ones can be pain in your throat, pain with swallowing, ear pain, weight loss, stuff like that. But if the cancer is on the vocal folds themselves, you'll hear it. You just have to listen for it. And it's usually not subtle. But again, if there's ever concern, it's always best to err on the side of caution and be seen and know that there's nothing going on than waiting, right? And so it's a really good question, though, because that's really important. So you listen and other people listen. If you hear a change in your voice for longer than a couple weeks, I would recommend getting it checked out.
How long does it typically take to benefit from voice therapy, or is it really across the board?
It's a little bit across the board, but usually folks just need about maybe 4 sessions, and they're usually less than an hour each, kind of spaced about a week apart. And what those do is they provide individualized exercises and strategies to improve that person's voice production, their efficacy of how they're actually doing it, how they're making the sounds. And then a lot of it is homework at home. Like, you've got to practice, right? It's like learning your math tables, right? You didn't just read it once and it was innate to you. You had to learn it. So it's the same sort of thing. The patient has to be invested in it, buy in, and use those techniques during that week. You come back, you say, hey, this is working awesome. This isn't working. And then you tweak the strategies, right? To see, okay, what's going to work better for you, right? And so it usually takes about 3-4 sessions to go through that. But it does require a good amount of work on the outside. After you get past that point, if you put in that work up front, the body wants to talk with ease. So if you retrain it and you create a new muscle memory for it, your body will start doing it. But it takes time, right? It takes work to get there. So it's usually people will notice an improvement within usually a month or 2.
Can somebody be more at risk for vocal issues due to genetics or other factors?
That's a really good question. So there's nothing really genetically from a lesion standpoint. I mean, there's other genetic-based voice disorders like tremor. That if you have tremor in your family, yeah, there's going to be a higher likelihood that you'll have tremor than not, or than someone who doesn't have that in their history. But diabetes isn't a risk factor. Hypertension isn't a risk factor. That type of thing. Not so much. It's mostly what you're doing in your own body, not just at that time, but in the recent past, that's housing your larynx to then create your voice.
I think we'll end on this question here, which is, are there any special things that you can do if you have atrophy of the vocal cords? Vocal folds, I'm sorry, vocal folds.
Yeah. So we say vocal folds and cords, they're basically the same thing. So, yeah, I would say just keep using your voice. And if your voice is performing well enough for you, then you don't really need to do anything else. If not, then seek care, because voice therapy or surgery, not likely, but most likely voice therapy can help you. And, having the voice be able to perform as you need it to and you want it to is really important, because there's a very strong identification of who you are as how you sound, which means how you think you're perceived by others. So all of that is very important. And so, yeah, maybe seeking care if all of that's not in alignment, because there might be things that can help you out.
All right, I want to thank Dr. Smith again for joining us and presenting today. And again, I'll put a plug in that April 16th is World Voice Day. We'll be celebrating here with the Eye and Ear Foundation along with Dr. Smith and her team. We're hoping to push some stories out to all of you, highlighting some patients who have had some great experiences getting voice therapy and being treated by Dr. Smith and the voice team. So hopefully we can share some of those stories with you and tell you a little bit more about what the Voice Center has been up to. So thank you again, Dr. Smith, and thank you for everybody joining us today. And we look forward to our next webinar in a couple of weeks, and we hope you can join us for that one as well. Thanks, and have a great day.